Hi, I'm Dr. Malwinder Singh. I'm a clinical oncologist. I'm also an EXCO member in Malaysian Oncological Society. Today we'll be talking about chemotherapy and its side effects. Chemotherapy is generally used in cancer patients. It is one of the systemic therapy which is normally used to kill your cancer cells. So how we use chemotherapy is actually we have a cytotoxic drugs with the aim of killing the cancer cells. Generally, chemotherapy is given intravenous into your veins or it is given orally. Those are the common kinds of mode of administration. But there are some cancers where we give chemotherapy differently. For example, intrathoracic, where we inject the chemotherapy into your pleural cavity, which is a lining in between your lungs. There are also chemotherapy where we give it intravesical, which is into your bladder for bladder cancers. And there are also chemotherapy where we give it intrathecal, which is into your spinal column, into your spinal fluid. Different cancers have different chemotherapy regimes. Some chemotherapy are only given once in 3 weeks, while some chemotherapy is given weekly. Okay, so it depends what are the cancers you're having and how the chemotherapy regime is prepared for it. Chemotherapy are generally given between 6 to 8 cycles for majority of the cancers. However, there are some chemotherapy regimens which can go up to 12 cycles and much more, depending on the cancer which you harbor. My advice for a patient who's going to start chemotherapy is always have an open mind. Never compare yourself with someone else because everybody is built differently. Everybody is getting a different chemotherapy dose, a different chemotherapy regime. So everyone will have a different side effects. Important thing is always talk to your doctors. Okay? There's a lot of newer chemotherapy drugs, a lot of new anti-nausea, anti-vomiting medicine all which we can use to reduce the side effects of chemotherapy. And importantly, keep yourself fit. You need to be able to exercise a lot, you need to be able to eat as much as you can, and if you really can't eat, take some supplemental formula. It helps to boost your immune cells also. Keep yourself active and healthy. And lastly, my final advice to my patients, I would like you guys to actually live a normal lifestyle during your chemotherapy because there is no reason for you to isolate yourselves, to stay at home. You can actually go to work, you can carry on with your daily activities. Just enjoy life during your chemotherapy.